So I think those are a couple of examples, hopefully that will address your question, Senator.
Thank you. I want to switch gears to the Workforce Development Initiative Facilitated Enrollment Program. There's a gap between job training that we're putting a major focus on and available child care. And there's been a lot of talk throughout this hearing about child care. There's a lot of funding and attention on workforce development and training for adults, but if they can't afford the child care, or they don't qualify for subsidies at 135% or 200% above the federal poverty rate, they can't secure child care, and they can't go to work anyway. And so, in regard to the WDI facilitated enrollment program that allows for these subsidies to be increased to 275%, and this program is implemented in various counties across the state. Erie County is not one of them. I've been making a major push to get Erie County included. There can be a case for making Buffalo, which is considered one of the poorest cities in the country, certainly in the state, to qualify for this through the WDI's program. It would bring in 300 families in Erie County. Is there anything standing in the way of making this happen?
Senator, I don't know, but I'm writing down notes. I'll be happy to look into that for you.
Again, the number we're looking at is $2.5 million. That's just for Erie County. That would bring in 300 families and allow these families to go to work and give them the ability to afford child care. It's a major priority for our community. I think it's important. Thank you.
Thank you.
Assemblywoman Mayer.
Good morning. Thank you for being here. Two questions. One is on the issue of making after-school availability clearer to parents. The department was directed by the governor's office, it's my understanding, to enhance the ability of parents to actually find funded after-school programs online. And I wonder if you know the status of the department's efforts to make it easier for parents to simply find funded quality after-school programs like they have in New York City, but we don't have in the rest of the state. I wonder if you know the status of the department's efforts on that.
Assemblywoman, I don't. I'll be happy to get back to you on that.
Okay, I'd appreciate that.
Of course.
And the second thing is, to the issue of the low percentage of children who are in subsidized care compared to the families that are eligible. One of the challenges is that counties have their own policies, as you know, and then there's no uniform policy across the state. What is the department doing to, from a policy point of view, to ensure that children are more widely, families know about subsidized care, and that you push counties to make every effort to ensure that more children are enrolled in subsidized care? I have the feeling the department has a somewhat passive relationship with the counties on this subject, and I wondered what is your approach to that?
Sure. So in terms of, education for families, as I said earlier, Assemblywoman, we do contract with 34 CCR&Rs across the state. So, they are embedded in communities. They should be the first point of contact for families, seeking care. So I feel like we've written, again, through a variety of modalities, have really tried to make sure that any family seeking care, that it's not that difficult to find help in answering some of those questions. With respect to the local departments of social services, Certainly one active step that OCFS has taken in the past several years is to make sure that local departments of social services are, to the extent possible, spending all of their child care allocations. And so 10 years ago, we allowed for a lot of rollover, was the term that we used. But in the recent years, we have set limits. It's 15% of the district's local child care allocation. Because there is fluidity and it's okay to have a little bit of wiggle room, but we do watch rollover, and if a district is rolling over more money that is permitted, we do reduce their allocation and redistribute it to other local departments of social services, making sure that there's not unspent child care money on the table. That could be used to provide subsidy to other families.
Okay. Have you ever challenged any county's determination of how much money they actually have to spend on subsidized care?
No, I don't believe we have.
Okay. Thank you.
Thank you. Senator Kruger?
Good morning. So following up on so many of my colleagues' concerns about child care and the inadequacy of funding for subsidized child care, Senator Kennedy just raised the plea for Erie County, City of Buffalo, and I would suggest that there's probably not one county who doesn't share the senator's views, that there's a hue and cry for more available, affordable child care throughout the state of New York. I'm a little confused when I try to get my arms around it, and I think your inability to perhaps estimate how many unmet needs there are is we split it all up between multiple agencies. So OCFS oversees OTDA, right? You're still the ranking agency over OTDA, is that correct?
I've never actually heard it referred to that way.
Okay, I think in statute you are. So in OTDA, and they'll be up next, I see actually a $100 million increase in TANF funding for subsidized child care. So can you help me and perhaps all of us understand how the state in totality looks at unmet need and attempts to address child care support for families in New York State who may or may not be on specific public benefits, but are all relatively low income, trying to get into or stay in the workforce? How do you do that work, and how does it come out that your division doesn't see an increase, but there's TANF money moved to it, and does somebody oversee the whole thing and go, well, this will help these folks over here, but we still aren't addressing these folks over here?
Mm-hmm. Right, so we do, with respect to the child care, we share the TANF fund, and we work together to make sure that the TANF fund is used as flexibly and as appropriately as possible. And so you're correct that in this year's budget, there's an offset. There's an additional $100 million of federal TANF money being used to support the child care allocation.
And who decides where that goes versus, I think the discussion so far this morning with any number of us discussing how desperately we need child care funds, probably not within the TANF eligibility.
So we do that. I mean, we share the same DOB unit, so there's good consultation between our departments and our unit chiefs, and I think that's where the shared decision-making comes in, Senator, about how the TANF and FFS funds can be used to support the various programs within our two agencies. As to more mechanical details, I don't have them right here today.
But okay, so can I ask you to do follow-up for us with some kind of documentation of, if one looks at the various funding streams that go through the state for subsidies to child care, what are they all, regardless of whether they're in OTDA's budget or your budget? What are the different eligibility standards for those? And an approximate number of children being served by, sorry, God was here for a minute. And is there a breakdown of numbers of children being served and geographic distribution? I think that would actually help all of us. Okay. Then following up on the issues of the only $10 million for $90 million worth of work, and the concern that we are actually simply placing this on the providers for them to have to pick up the costs if the federal government doesn't either allow us to delay, which Senator Squadron points out, puts our children at continuing risk for these things happening if we're delaying, or places the costs on providers. Does your agency evaluate how much providers, what kind of margin the providers are operating on now? I mean, when I hear that the state is asking them to pick up $80 million of new costs, or potentially asking them to pick up, I'm curious, like, how much of a bite is that into the actual ability of these providers to remain open? Because I hear constantly the reimbursement for the kids is incredibly low. The cost for the parents continues to grow percentage-wise, perhaps unrealistically for many people. And now we're basically placing, I guess I would call it in Albany lingo, a new unfunded mandate on, even if it's the feds handing us the mandate, an unfunded mandate, not on the localities in this situation, but on the actual providers. So is there any mechanism for evaluating sort of what share of their total income we're asking them to have to turn over for these new costs? I'm wondering if you know that now.
I do not know that answer. But
Okay, so if you could also get back to us
Yes, I'll
on that,
add it to
because
my list.
clearly you're seeing that we are all very disturbed about the concept that, so yes, the feds should have given us the Monday if they were making the mandate, but they don't seem to be cooperating. And I think you are hearing here the concept that asking the child care providers to pick up these costs themselves not only is unfair, but may actually be the straw that breaks the camel's back and results in our having fewer child care providers who are following the laws in New York State. So I would love if you could get back to me with that also. I'm out of time. Thank you.
Thank you.
Thank you, Senator. Assemblyman?
Thank you. Assemblyman Goodell.
Thank you very much, Commissioner, for being with us this morning. Of course, we've talked a lot about the additional $90 million costs coming down from the federal government and the lack of additional funding in your budget for that. But that's only part of the costs that the child care providers are facing. The governor's also proposed, as you know, nearly a 70% increase in minimum wage. Are we anticipating a 70% increase in funding for child care support, or a reduction in our commitment to child care support by 70% over the next several years? Do you have any visions or perspective on that?
Thank you. It's a very good question. So I do know that the administration, has the goal of raising minimum wage, but I think there's also a recognition, Assemblyman, that there's got to be some deep analysis and the appropriate time taken to consider the impacts of that analysis. And so we are working with the division of the budget, I think, to address that very kind of analysis that you just asked. It's not yet complete, but I think taking all that information in will really help guide the administration and the legislature about how we could raise the minimum wage.
I would certainly appreciate that copy of that analysis if you can provide it to me, because obviously I don't want to be in a situation where I'm voting for a cut in daycare subsidies, an effective cut, by imposing a substantial increase in the cost without providing an appropriate level of funding. So if you could provide that to us, that would be great.
Thank you.
I want to change topics just a little bit and talk a little bit about the raise the age. Am I correct that under this proposal we create a special youth division in Superior Court and we eliminate the role of all the town courts, the town justices, even on misdemeanors?
I'm not the expert, I'm not an attorney, and that was probably a great question for Commissioner Green at DCJS, but what I do know is that there will be the creation of the youth part in the existing criminal court. Those judges will be trained to handle those cases, but I also believe, Assemblyman, that there is recognition particularly in some of the smaller rural counties, that some of those new youth parts may need to create training opportunities for the existing, judges who wear multiple hats.
Well, I just would point out that, a lot of times the 16, 17-year-olds get into minor scrapes, if you will, with the law, involving misdemeanors, criminal mischief, petty larceny, trespass. And there's a number of minor crimes that are not felonies that might best be handled in the local court, justice court, with a town judge who knows the family, knows the situation, often knows the kids. And I would really encourage the administration not to move those minor crimes into the criminal court system.
Perfect.
The other concern I have is that there's no secure detention at all operated by OCFS in my county. I mean, I represent over 1,000 square miles. So if we eliminate any incarceration, even in the local jail, that means low-income families would have to drive hours round trip to visit their son or daughter. And in the rural counties, we don't have subways, that run from Jamestown to Buffalo. We don't even have above ground trains. We don't have mass transit. It's a huge imposition and a real disservice if we can't provide youth detention facilities that are relatively close to the families. So I would ask you, I know you've mentioned in response to Senator Colucci that you thought there would be enough spaces, but it's not just enough spaces, it's the location of those spaces as well. Can you address that issue?
So one of the things, that I think we are proud of in our own state-run juvenile justice system, again, we also try, whenever possible, to find a placement within our system that is as close to home as possible for families for the very reasons that you articulate. And so, when we would grow our system, to accommodate the need for more secure facilities in a raise the age scenario, one of the things, Assemblyman, that we would certainly look at is where are youth coming into the system, right? So we try and have a strategy and build the new capacity in those areas for proximity reasons. So that's the first thing I would say. The second thing is that we have a big focus within our current New York model and our juvenile justice programs on supporting family visitation. And so we provide bus transportation. We pay for families and siblings. And in some instances where we have young people who are parents to come up to our facilities, have protected family visiting time, and we really try and support that, knowing that it improves the likelihood of success upon reentry into the community.
Thank you, Commissioner.
Thank you. Thank you very much. I'd like to point out that we've been joined by Senator Belmonte Montgomery. Welcome. I would like to question, because I have several questions, and I'll probably have to come back for a third round as chair, but we've touched on it a little bit, that the governor has once again included Article 7 legislation to raise the age of juvenile jurisdiction and implement juvenile justice reforms. And under the proposal, the age of juvenile jurisdiction would rise to 16 years old on January 1st, 2018, and to 17 years old on January 1st, 2019. And we've asked some questions about the juvenile facilities. I would like to associate myself with Assemblyman Goodell's concerns about, in the western region, all of the state facilities for youth have been closed. And in fact, Great Valley was closed by the state a few years ago. Cattaraugus Limestone was closed. And so there is a great deal of travel time for families if they want to go visit their children in another part of the state. So I just would like to point that out. But how many additional youth do you envision being placed with OCFS as a result of raising the age?
So if the bill were enacted as proposed, Senator, there would be approximately 700 additional youth at full implementation that would be served within the OCFS system.
And as you previously stated, you feel that the system as it exists right now would be able to handle that excess capacity?
Some of it. I mean, we have some capacity within the system, but I think we would also look to, some facilities that we may have decommissioned in the past. We'd have to really look at the whole picture if the bill were to pass. But it's possible that some new facilities would need to be reopened.
How many do you have as detention facilities currently right now under OCFS?
So we have one reception center that's in Brooklyn, and that does assessments for youth coming into the system, not secure youth, but youth coming in for a limited secure and non-secure care. And then we have 11 other facilities. We have, I think, 4 secure facilities, and then the rest are a mix of limited secure facilities and non-secure.
Okay, thank you. How many of the facilities in the state are operated by OCFS, and then how many are voluntary agencies?
So there are approximately 88 voluntary agencies across the state operating a variety of foster care and juvenile justice programs.
Thank you. One of the issues that I've been concerned about over the years is the high rate of violence within the facilities. And it's been both on youth and then youth on staff. And as a matter of fact, it was a bipartisan effort, but the Democratic Assemblyman and I actually looked at the figures a few years ago, and workers' comp cases pointed to the fact that these facilities were the most dangerous places to work in the state because of the violence on the staff. So could you please tell us about what the current rate of violence in the juvenile detention facilities is, both youth on youth and youth on staff?
Certainly. So I think overall, last year our number of restraints on youth is down about 15% from 2014. Our youth on youth violence is down slightly by 2%, and our youth on staff assaults was up slightly by about 3%. I would also just add, Senator, as a point of, I think, important information, while workers' comp claims are up, part of our model, as you may recall from our previous system and our involvement with the Department of Justice, was moving away from a prone restraint. That a restraint was the first response as a way to manage a situation. We've done a tremendous amount of work in the past decade or so creating an alternative model that balances accountability and recognizes that these are young people who have a lot of mental health needs and other services. So our restraint model that we have created now is a whole continuum of de-escalation, evidence-based techniques that we have learned. We've also consulted with docs to help improve our de-escalation techniques. But the fact of the matter is that a fair number of our workers' comp claims are as a result of a staff perhaps having a knee injury while safely performing a different type of restraint than they did in the past. So I think that's important context when we're talking about the violence. The other thing I would say that is different is that even when there are situations where the youth are having a fight, one youth is going after another youth in the facility, those things are going to happen when you have young people, living together. They can be impulsive. They're living in a relatively confined space, with that group. I think you can all appreciate that. But I think what we've tried very hard to do as an agency is how we manage our response to those incidents so that they are addressed very quickly, that they are managed, and we have made tremendous investments in our facilities to have enhanced staffing, to have additional cameras, to have specialized security staff, as I said, to have specialized de-escalation techniques. So, Senator, I think our OCFS system today, honestly, is a very different system than the one some of you may recall, from a decade ago, and certainly would encourage all of you to come out and visit some of our facilities so you can see firsthand, I think, some of the changes we've tried to make.
Thank you for that. And you said there were some minor reductions, 2% and 3%, and I would say to you that as a state, it's our responsibility to keep the youth that are under our care safe, and at the same time, it's an important responsibility to make sure that our employees are safe. And I would appreciate any workers' comp case statistics or information that you may have. I don't know if you're prepared today to give it to us, but, you know, do you have that, the number of claims for employees in these facilities?
I don't
And
have
the
it with me,
value?
Senator. Would be happy to follow up with that information.
That would be very helpful. As you know, we've had tragedies that have occurred. One that comes to mind is Renee Greco, who was murdered in a voluntary agency house in Western New York by some of the youth that were there, 19 years old, for example. Since that time, what changes have been made in those types of scenarios? Because she was, you know, in her early 20s, left alone with 6 youth. Some had a history of violence, and you know, as a result, we had a tragedy. So, have there been any changes to address those situations? Because it was hard to imagine why a young girl was left in charge of people with those kinds of criminal histories.
Yes. So, Senator, you may also recall that after that terrible tragedy, as you just described, occurred, you know, OCFS took immediate action with that agency, and that particular program has since closed. I think generally speaking, all of our foster care providers, including those that run the type of facility that you mentioned, are intensively focused on employee safety as well. So there's additional training, there's enhanced staffing. In fact, we just had a meeting with CAFCA, the Child Care Agencies, to really engage in additional conversation together. How can we continue to explore improving safety? But I think it's fair and accurate to say that following, you know, that tragedy where a young woman was on staff alone that evening, is something that you would not find today in one of our agencies across the state. The other thing that's changed substantially, Senator, is the fact that the Justice Center has also been created, and again is another additional level of oversight, not only to certainly protect the vulnerable people who are being served right in a variety of programs, but also to hold all of us accountable in those running programs to make sure that we're doing a good job keeping staff safe as well.